Hey guys, welcome back to another episode of the SmartLife podcast. Aaron Taylor here, your host. And this is just a podcast where, I'm always looking like, hey, who's leveling up? Who's growing? What are people doing that are probably doing the things that you love to be doing, that are just finding success? Somebody asked me the other day, like, hey, the people that you're interviewing, where are you finding them? How are you finding them? And sometimes you have to look just even in the backyard. Like, you remember that show? What's that show? I think it was the Home Improvement, where the guy was just over.
Oh, yeah, yeah.
Yeah. Sometimes you just got to look. Sometimes
Yep.
you gotta look over your fence and say, who is this person? Who are,
Yeah.
like, you just never know uh, who you may come across, the relationships that you have. There are people that are in your life that are finding success just doing the things they love doing, and they're building a life and legacy. So I wanted to bring a great friend of mine on here, so I'll just quickly introduce her. Amanda Robinson, wonderful young lady, very passionate. She's been in the dental industry now for a few years, dental hygienist, and now she's growing, elevating. She's starting her own business, obviously. And what I love is just the passion and what she brings to the career and what she's doing, just kind of spark some hope. And I'm very excited to just have you on here. And I just kind of want to touch base, Amanda, on this whole entire journey. You and I, obviously, we were talking the other day, just kind of like your entire story. But I think this is a great opportunity to kind of tell others, like, hey, where did the drive come from? Where did the passion come from? Was this something that you absolutely wanted to go? Was there another route that you were pursuing? How exactly did dental hygienist all of a sudden just come into
Yes.
the path?
Yeah. Thank you for, having me on this podcast. I'm really excited to be here and talk about something that I just truly love and am passionate about, and that is dentistry and the airway and having proper function of everything. But, like you said, we do know each other from so long ago, so you know where I kind of came from. So I am the oldest of eight kids. I grew up on the east side of Tacoma, so maybe not the best neighborhood. So uh, I just really wanted to work hard because when I saw other people work hard and saw where that took them, that was obviously an interest to me. So as I started to go through school, I was not a good high school student. I wasn't. I barely made it through high school. I got my act together in senior year. I was able to graduate on time with a lot of extra work. And I learned, um, if you don't get behind, you don't have to catch up. And so I took that lesson when I started college. And I just knew the statistics of if you go to college, your chances of being financially stable were better. And I grew up in a very unstable financial household. Watched my parents struggle paying bills, always calling to get an extension, losing their car to losing their house to, I saw that, I lived that. And I always thought, like, oh, I really got to make sure that I create stability for my future financially, because at the end of the day, you can't rely on anyone else to do that for you. If you want to have that, you got to work to have that. So I made it into my prerequisites at a community college here in Tacoma. I actually was going to go to school to be a teacher, an elementary school teacher. Being I am the oldest of eight, I am great with kids. I nannied a lot. I have always loved kids. And I actually found out I loved science. I took chemistry. Like I said, I wasn't a really good high school student, so I don't remember taking like chemistry or biology in high school really. Like I really just made it just squeak by. Um, and I fell in love and I said, oh, I need to follow like I gotta follow this path because I'm good at it. I enjoy it. I actually ended up tutoring all the different sciences while in prerequisites. Uh, and I knew I wanted to be healthcare, but I just didn't know what exactly. And it was actually my own journey of my dental care, a lack of dental care, that got me interested in that field of healthcare. So I didn't grow up with dental care myself, coming from a big poor family who my parents didn't really grow up with dental care either, right? And you don't know what you don't know.
Hmm.
And so I didn't start going to the dentist until I was like 19.
Wow.
And I went because I was in pain. I
Wow.
remember going once in middle school. I don't remember going in high school at all. Even my sister and I talk about it. Because now my sister has two kids and she's very good about taking her kids to the dentist and teaching them home care. Um, and her and I talk about like, gosh, we wish we would have had this growing up because now as adults we're quite literally paying for it. Um, but I just had a rockin' hygienist and a rockin' dentist who just saw this young adult who is financially responsible for herself, no insurance, right? They helped me in so many ways with getting me the care that I needed. Uh, and my hygienist, she was so good at educating me,
Hmm.
and letting me know, like, I know you're not flossing because, uh, and I just thought, God, I wonder if I could help people not get into the position that I'm in. And then I started looking at the classes. Um, it was very similar to what I was already taking because it's a general direction, right, of healthcare, nursing, and dental hygiene have very similar prereqs. So
Hmm.
it wasn't a big um, course change for me as far as my classes went. And I looked at how much schooling it was. I looked at um, how much I would make. And then I thought about how much I would save on my
Hmm.
own dental work once I was in there because I was such
Yeah, you can
high
give yourself a
risk, you
discount, I
know?
guess.
Yeah, it's expensive, right? Like, oh, you need a root canal and now you need a crown and now you need this fillings and now you need this. And it's, I very much was in need of those things. And 19, 20 years old, going to school, working, trying to pay for it all, it can be really challenging to
Hmm.
afford that kind of stuff. And I actually used some of my school loans and there's a interest-free credit card that you can use for healthcare and other things like prescription and chiropractic and dental. Um, so that's what I signed up for, and I started to build my credit. That's how I
Hmm.
started my credit,
Yeah.
um, and so that led me into becoming a dental hygienist. And I was so glad I liked it when I got into the program, and I was so happy that I was good at it because I didn't know if I was going to be. I was not in dentistry beforehand, right? I worked in the
Hmm.
restaurant industry. So it was a bit, to me, it seemed like, well, this is going to be a risk. Maybe you'll love it, maybe you won't. But
Hmm.
if you don't love it, you can figure it out while you do that and go from there.
Yeah. So let's dive into that. So you come from the restaurant industry. Obviously, you had a pretty long, pretty hefty career, I'd say, in that. And then now you're making the switch. So you're going into basically the medical field. So how are you adapting your mindset as you're taking these classes? What are you telling yourself? How are you coaching yourself? Is somebody coaching you throughout that process?
Yeah, yeah. Great question. Oh gosh. So prereqs, during prereqs, I made hard on purpose. I knew you had to practice what you play. I've always been good at like pushing myself, even when you're tired, shuffle, right?
Hmm.
You don't have to take full strides, but you can't stop or walk, shuffle. And so uh, I made sure I had a good support system. I had a mentor through my community college. I took her for all my science classes, and she actually was sad when I told her I was becoming a dental hygienist. She thought it was
Really?
Yes, she thought that I had more potential than that. She wanted me to go, she really wanted me to go like into the hospital setting medical, like either
Hmm.
nurse practitioner,
Hmm.
medical doctor, something along those lines.
Okay. So
And
how did you
I'll
feel
know,
about that initially?
oh my gosh, when she told me, Erin, she said the words, I just think that's a low goal for you. And I was like,
Wow.
oh
A
gosh.
low goal.
I was
And I'm
like,
thinking because dentistry, anything that's in the medical, I'm always thinking, well, that's got to be a high goal because not
yes.
everybody can handle that type of capacity,
Hmm.
the type of
Yeah.
learning curve that you have, the type of hours, the type of commitment that's required. So,
When I
you know,
don't think she knew the how competitive it is to get into hygiene program either,
oh
right?
wow. Hmm.
So, uh, but when I was in my prereqs, I was never afraid for help. I would go to the tutoring centers. Oh, I lived in the tutoring center for math for sure. Math is not my strong suit, but I knew how competitive the program was, so I knew I was you have to have a strong GPA. So if I'm gonna do it, like we got to try our hardest. We got to try our
Hmm.
best because we pulled out loans. Now we have to finish, right? We
Hmm.
can't quit because the last thing you want to be is in debt without a career.
Right.
And I didn't want to be in debt, right? Because I watched my parents and how that affected their life. So I did have in my prereq someone that really uh, helped me know, like, helped give me that mindset too, and
Hmm.
showed me how, uh, like, the kind of dedication that you needed. So I definitely like found my routine. I found my groove. I stayed in it. I limited my distractions. I kept to my study spot. I made a plan with my counselor. I had help getting all the paperwork done. I made sure I had someone double checking, making sure I'm not missing any classes, right? My guidance
Hmm.
counselor, like for this college here, like let's make sure we got all the equivalents of our classes here at this college that we offer, right? So doing all that admin and that paperwork and having someone double checking it, because like the last thing you want to do is not be able to apply because you
Hmm.
forgot one class or something. So
Hmm.
um yeah, during those, and I didn't work as much during the prereqs either, so that was helpful. But worked just enough.
Hmm.
And the tutoring I did, not only because I loved science classes, but because it also gave me priority registration at my community college. So if you're an employee of the college, you have to register for your classes first so
Hmm.
they can work your schedule around your class schedule. And I knew I was going to need certain classes that were in demand.
Hmm.
So I made sure I was an employee so I could get into those
Wow.
classes to stay on track to apply on time.
Hmm. That's good. A lot of people that I've talked to, whether you're in the dentistry or you're a medical doctor, one of the common things that people talk about is they talk about the work-life balance a lot. Like, okay, if I'm going to enter into this field, how do I actually balance that out? How do I balance my personal life? And
Hmm.
then now I'm working to build a
Yeah.
professional career. So, what was your balance that you had or routine that you had to develop? Where you could not only focus, you could study, but you also had to set aside time to where you're not uh, physically exhausted from so much work. Obviously,
Hmm.
I know you worked a little bit, then you had to study, but now
Yep.
people talk about like, can I have a social life while I'm doing
Yeah.
while I'm in the medical
Yeah.
field?
Yeah. Yeah. Oh yeah, you can, if you know how to time management, right? And if you don't get
Mhm.
behind, you don't have to catch up. You can make it happen. I don't have children, so it's a little bit, some would say a little bit easier to balance, right? Because I'm just balancing my own life. I'm not also trying to balance small humans' lives as well. But during my prerequisites, I think one of the funnier things that I did was my best friend from OMAC was turning 21, and
Mhm.
I was going to make her 21st birthday. She is my best friend. It's a milestone birthday. I had finals that weekend, and I go up to her house, and she's having just a traditional house party. And at one point, the whole party simmers down because I have to take a test. and I have to get it in by a certain time. And this is like, it's an online test. So,
Hmm.
and then what's this in my prereqs? While I was in the program, I would go over to friends' house. Like we would have Sunday football traditions and stuff like that. And I would put my soundproof earmuffs on to be able to do my work, to study and stuff like in their dining room. And then once I was done, I would go join the social things. But you do sacrifice your social things, but you have you have to prioritize, and school's not forever. And you try to find social time where you can, staying staying healthy,
Hmm.
doing a little bit here and there has never been hard for me. Wake up and do a little bit here, come home, do a little bit there. As far as like doing a quick workout or something, that's never been too challenging for me to squeeze in. But like even during school, but uh, sometimes you just are gonna miss it. You're gonna miss it, and you can't have FOMO.
Hmm.
And you just got to stay focused and stay zoned in and appreciate the little gatherings that you can have.
Hmm. Yeah. One of the things that I like what you did is even if it was just kind of small, whether you
Mhm.
could, okay, I can give you about 10 minutes, I can give you 15 minutes, I can give you an hour of my time. But I also have to make sure that I take time to study. So at the
Oh yeah.
same time, I like that balance because it shows that, hey, I'm not just present with my school, but I'm also present with my relationships. I
Yeah.
want to be present with my family. And we all have to remember we have the exact same time in a day. So when we really think
Yes.
about it, can we make time? Absolutely.
Yeah. Yeah.
100%, we can all make time. It's just a matter of how do you properly balance that out, and how you've been able to do that. I think is exceptional. And again, you touched on it earlier. It's only temporary. It's really just that
Mhm.
temporary
Mhm.
provision timing where, yeah, it's only 4 years or 6 years. If depending on if
Yeah.
you're
Yeah. Yeah.
additional certifications, maybe that might take you a little bit longer. But it is a temporary sacrifice for
Yeah.
a long-term benefit that we have. What are some of the apps? What are some of the benefits that you love, or that keeps you just every day? Hey, this is one of the reasons why I love going to doing dental. This is one of the reasons why I absolutely love the field that I'm in. Talk about some of the things that you love doing.
Oh yeah. Okay. Well, you got a couple days.
We may have this may be a part two, part three possibly.
Gosh, it's there's so much love and care that goes into every appointment, right, with your patients. You get so much one-on-one. It's a very unique position as a healthcare provider to have that kind of one-on-one, and you see that same person two, three, four times a year, right? Um, but it's fun too. The dental being a dental hygienist, my patients are fun. I love my workplace as well. It's crafty. It's an art, dentistry, right? Seeing some of the dentists work is beautiful. It really is. The in hygiene school, we had to carve teeth out of little blocks of wax. We
Oh
started
my
with
goodness.
a little cube, and by the end of it, we had to whittle down the actual size and shape of the tooth. And that was literally one of my favorite classes because it was just artsy, right? And that's how you learn the anatomy in hygiene school. That's one of the ways. So I love the art aspect of it too, but just helping people get out of
Mhm.
mouth pain. Mouth
Yeah.
pain sucks,
Yeah,
right?
it most certainly does. It
It's
most
no
certainly does.
fun. Like even when your gums hurt,
Mhm.
because when anything gets infected on your body, it doesn't feel good. It
Mhm.
doesn't feel good at all,
Yeah.
right? And now you have to aggravate it every day, or at least you should. Um, and so being able to educate people to have better home care so they feel better, you know, taking care of themselves, and that can start to snowball, right? And we can get them taking care of themselves in a lot of other ways. It's routine to take blood pressure at our
Mhm.
dental office. It is the standard of care, but maybe not everyone makes the time for it. Um, and I recently had a young patient who I had to dismiss for his blood pressure. 22-year-old, it was very high.
Mm,
And he, we had a talk. I always tell my patients, like, we care about you as a whole. Your teeth only do us so much good if your heart's not doing good. If your heart's not doing good, we got other things to worry about. That's a bigger issue for us.
mhm,
So I actually dismissed him, and he chose to walk across and go to the urgent care, because this was a slight concern in the past. But then they moved and moved uh, medical doctors and such and such. Anyways, he gets there and he was placed on high blood pressure medication and accepted to start taking them. I see him a few weeks later to get him back in, he's a new patient, to get him established in our practice. And he tells me all these changes he's making. He's walking every day. He's watching his sodium intake. He is monitoring his blood pressure at home. And these are things that he wasn't doing prior. And, we talked about how everything in life is hard. Everything, and everything's a choice, right? Flossing is hard, but getting fillings is hard too, right? Being healthy is hard, and being unhealthy is also hard, right? Everything is hard. We pick our hearts. And so just getting down and like leveling with him and just talking with him about how he has the power to turn this around. He
mhm,
has the ability to get healthier, let's get that heart healthy, and then let's talk about that mouth, right?
mhm.
And seeing those kind of changes as well. Oh, yes, please live longer. I want you to live longer.
Yeah, I think that's great. It kind of reminds me. I remember when I had my wisdom teeth taken out, and uh, I don't even think we got very far into the surgery. And I remember the surgeon had stopped it because he saw something. I don't know what was going on. I don't know if there was just something with like within the
We'll
like
say
my blood
suspicious.
pressure. But yeah, a very similar thing just happened to me because he dismissed me from that process because he wanted to just kind of be sure, like, hey,
Nice.
we go any
Good
further,
job.
I need to make sure that this guy's
Yeah.
okay.
Yeah. Yeah.
Um, and I'm walking out of the place, and half my mouth is already swollen.
Oh,
So
yeah.
I'm thinking
Yeah. Yeah.
like
Yeah.
oh, are we done? No, they had to tell me we had to stop for
Oh, yeah.
a possible medical scare. But it's that same transparency and that
Mhm.
same just kind of apathy that you mentioned that I think it makes dentists and hygienists very unique. They show they care. I
Yep.
didn't realize all the stuff you were talking about carving through the wax. Maybe that's everything that I'm looking at every single time I'm in the dentist room. Maybe that's what maybe that's what I'm looking at all the time is everything that they've carved.
Yeah,
Yeah.
honestly, it could be. Not every school does it. Some make you do like
Mhm.
just draw on paper
Mhm.
and do it that way.
Mhm.
But I actually, you really learn the curvatures of the tooth when you're whittling it, right?
Mhm.
And that helps you have better adaptation with your instruments. So that way you're not damaging the tissue, and
Mhm.
it's more comfortable for the patient, right? Who will come back more often if they're comfortable. So it taught us a lot
Mhm.
of things in hindsight, because in the
Mhm.
moment you're just like whittle, 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 whittle. You don't understand like the big picture quite yet, and then you get out and you're like, oh, this is just like when I was carving the tooth. Okay.
Yeah. So, question here. And this is a question I had discussed with a friend of mine, and we kind of, and I would love to get your perspective on this. Is that there's many people now that are constantly, we find that they're putting off dental care. So, and you've stressed so much of the significant benefits of that. Why are we seeing more people just kind of delaying that moments like, hey, you need to get a cleaning,
Mm-hmm.
but you're pushing it off. It's been a year, it's been 2 years, it's been
Yeah.
5 years, and you're
Yeah.
not taking
Yeah.
care of your mouth.
You know, there's so many reasons. I, I, as a hygienist, had went 1.5 years between my cleanings, and I literally was like, been a year and a half, holy cannoli. But my first office, I was the only hygienist. So I would go to another office to get my cleanings. And then life got busy, right?
Hmm.
Co- COVID was a big one. I graduated in 2019. So we got a lot of patients in the beginning of my career that had not been in for a long time because of the fear of COVID. But you don't know what you don't know. Maybe they didn't grow up with it. Maybe they can't afford it. If it doesn't hurt, right? A lot of disease in the mouth is silent until it's not.
Hmm.
Um, and even that, our mouth and our body is so fantastic at compensating. If you get a bad enough infection, it will act as the and like it would numb that area, act as like an anesthetic to get you out of pain. You'll develop a fistula, a little pimple on the gum that will release your pressure and get you out of discomfort. Uh, Access to care, how expensive it is,
Hmm.
crummy insurance, insurance benefits, dental benefits, we like to say now, that
Hmm.
hasn't been updated since the 70s. We as hygienists are so limited on where we can be. We need to be utilized more. We're very type A, go-getter, smart people. So putting us in hospital settings, assisted living home settings, getting us in schools, getting us so we can own our own business and have autonomy and have our own practice, which like Colorado has, right? You can,
Hmm.
and Canada has, which is cool, allowing us to grow um, and giving that access to more people. But
Hmm.
there's so many reasons. But when you're in my chair, it doesn't matter.
Yeah.
It doesn't matter how long it's been. I've cleaned people who it was their first cleaning of their life. They were 40 years old, and all I cared was that they were in my chair that day, right? So I always make sure to let my patients know, like, I'm here to help, not to judge. Like I'm the last person to judge.
Hmm.
I'm very high risk myself. I've gone long periods between cleanings myself. So yeah, that's there's so many reasons, but hopefully with, access with internet and everything and more people talking
Hmm.
about it, that more and more people will be able to get their teeth cleaned because some just aren't able.
Yeah. I think tooth maintenance is something that I've kind of definitely, it's one of the things I've kind of made sure that I put a priority in terms of, okay, what am I eating? What am I
Mm-hmm.
drinking? Like because
Yeah.
sometimes you can kind of look in the mirror and you kind of wonder like, hey, is there some discoloration starting to show
Mm-hmm.
a little bit? I mean, I just saw
Yeah.
the dentist not that long ago. You go from like a pearly white and then now it's like, okay, now it's kind of color fading a little bit.
Your imagination just starts running crazy. Next thing
Yeah.
you know, a tooth falling out. No,
Yeah.
that's how it goes, though. We start to spiral. We're
Hmm.
like, our imagination will run nuts, especially when it's something we don't know something about, right? It is a specialty, and I even find myself um, thinking my knowledge is common because to me, if I know it,
Hmm.
shouldn't most, because again, I just feel like I'm like most, but I've learned like, oh no, we can't assume anybody knows anything. So when someone's in my chair, I'm just like, oh, they know nothing. And then I
Hmm.
start from there.
Yeah. That's totally fair right there. Um, One of the things that I constantly see now, I think one of the biggest advertisers, and the dentist industry is very good at advertising a lot. They advertise a lot in terms of like, branding, things to kind of like, hey, this will be good to for whitening, for getting all that, you know, bacteria, prevent cavity.
Yeah.
And so sometimes I'm kind of wondering, okay, like for example, let's say if I'm holding up two different brands of toothpaste and I'm kind of doing a comparative analysis, like, okay, brand one uses this ingredients, brand two
Mhm.
uses this
Mhm.
ingredients,
Mhm.
and people kind of wonder, I've seen this advertiser, I've seen this advertiser. I have
Yes.
no idea what I have no idea if this is good or if that is good.
Yeah. Yeah.
Is
Yeah.
there an option three? I mean, there's 10,000
Yeah.
probably brands now that we see.
Yeah. She go down that toothpaste aisle, huh?
Yeah.
Holy cannoli. Yeah. When I travel, I like to go down the toothpaste aisles and compare. see what other places have too.
Mhm.
And it can be overwhelming. And I have to really restrain myself when I go down those toothpaste aisles to not tell everyone in those aisles my opinion. Um, but it can feel like a lot, and you should care about the ingredients in everything, in all our products, right? What we put in, what we put on our body matters. And that's becoming such a big conversation nowadays, and I'm here for it. Because we should try to limit what kind of maybe not so great ingredients go into our body. So most 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 things in stores, I'll be honest, I'm not the biggest fan of most in-store toothpaste, like over-the-counter toothpaste.
Mhm.
There's a, there's always the hot topic of fluoride, which now gets pretty political, but that's not even the ingredient I get upset about, honestly. It's the inactive ingredients that I look at. So looking for like sodium lauryl sulfate or SLS or any kind of derivative of it, because now they're getting tricky and saying SLS free, which is a foaming agent. So if you like on your shampoos and your conditioner bottles, it will say SLS free or sulfate free. That's what they're talking about. It's that foaming agent, and it was
Mhm.
proven to not be so great for our scalp and our skin. It's also not great for the soft tissues in our mouth, so like our gums and our cheek and our tongue and our throat and
Mhm.
everything like that. That foaming agent creates a sloughing effects and takes off the top layer of your cells, so it
Mhm.
doesn't benefit the bacteria in the mouth whatsoever. And
Mhm.
other countries just don't use it, and other brands don't use it. Most store brands use it. The other one that I'm a big like absolutely no go on is titanium dioxide. That is a whitening agent. It's to give that bright white appearance.
Mhm.
Um, you whitening toothpaste is not going to whiten your teeth. It's just going to scratch off your enamel. It's such a gimmick. If you want to have whiter teeth, we could talk about good products for that, but toothpaste is not it. So I am
Mhm.
a big fan of some toothpaste you can get online now on Amazon, actually, to make it even more convenient. And that is Rise Well toothpaste. And again, I'm not affiliated with these brands or anything. I just love them for their
Mhm.
transparency. I love them for their ingredients that are focused on benefiting the bacteria in our mouth. And that's kind of the direction dentistry is going, where
Mhm.
we now know we want to nurture the bacteria in our mouth. It's like a garden, right?
Mhm.
You want to go get the weeds out so they don't overtake. You want to fertilize it every now and again so things blossom. You don't want to go through and like chop everything down every day. So now we know, and more products are getting on board with that. So Risewell is one of my faves.
Mhm.
And then Fig, FYGG, it stands for Feed Your Good Guys. And again, every ingredient in there is benefiting the bacteria for our best intentions.
Mhm.
So I'm a big advocate for those kind of toothpastes.
Mhm.
And you can just get them online. Whole Foods has Dr. Jin's. That's another good one, and David's. That's another decent one.
Mhm.
If you're looking for an over-the-counter one, but yeah, just looking at the
Mhm.
ingredients and something says kills all bacteria, like whew, red flag.
Yeah.
We don't want to kill. And how do you know what bacteria you're killing? So like the
Well,
Crest
we don't.
detoxifying gum health
Mhm.
toothpaste is like kills bacteria, and I did ask the rep, I'm like, how do you know what bacteria you're killing? Are you killing just the bad guys here, or are you killing the good guys too? Because
Mhm.
we need those good guys to keep the bad guys at bay. And
Mhm.
when we have more bad guys than good guys, that's when we start having issues. So I really try to gear my product recommendations towards
Mhm.
creating a nice,
Mhm.
healthy, balanced
Mhm.
oral microbiome.
Yeah. You know, I asked you this the other day, and there's a stat that I kind of threw out, and it's like 32% of people only brush twice a day. So there's a large
Yeah.
percentage of people that don't brush 2 times a day. So,
Mm-hmm.
in your opinion, like for that's 68% of people that are basically putting themselves at risk? What are
Yeah.
the risk of if we don't brush twice a day versus you're only brushing one time a day?
Yeah. Um, we would actually rather you skip brushing than flossing. So I'll just put that out there right now that flossing is that much more important than our brushing. But yeah, the statistic is, people on average would brush once a day for, I believe it's 38 seconds, right? So they're not even getting that full 2 minutes. And this is just a dark, moist area that you're storing food in, right?
Mm-hmm.
So if we don't get that bacteria out and we give it this great environment to thrive in, um, bacteria is very focused, right? Bacteria does not have ADHD. It knows its job and it
Mm-hmm.
will continue to do so unless we stop it, right? So if you're not brushing and flossing, then that's putting you at risk for things like gingivitis, periodontal disease. You can start getting bad breath, tonsil stones, right? And then, if the big picture, if you continue to become unstable and you get periodontal disease and you don't get it stabilized, right? And now you're swallowing all that bacteria. It's getting in through your gums and the floor of your mouth into your bloodstream now, right? And I always tell my patients, here's your mouth, here's
Mm-hmm.
your brain, here's your heart. Not a long way to travel until it's there to cause mayhem, right? And the statistics on what it can do to the whole body, um, they to me, I'm like, oh, that's a little scary. Like I could be preventing some big systemic conditions by something that is as simple as, yeah, brushing and flossing. But also eating right and making sure
Mm-hmm.
we're not mouth breathing, right? There's so many factors to a well balanced oral microbiome, but like that's the beginning right there. Just getting in there and brushing, getting in there and flossing, and then we can build from there.
Okay. So if I see somebody that I know that has bad breath, maybe I should ask them, "Hey, did you floss today?" Hey, did you?
No, if you can smell someone else's bad breath, you need to ask them when's the last time they got their teeth cleaned.
It's yeah, it's
That's what
that's
you gotta do. You can be like,
I come across
is
those
it like
instances.
casual, is it casual morning breath, like a little stinker, or is it like, oof, like can smell it from a little bit of ways, because if you can smell it from a little bit of ways, more than likely they have some periodontal disease going on. We call it perio breath. Um,
Perio
and
breath.
it's
Okay.
perio breath. I had one patient describe it to me as like dog breath. And I was like,
Oh,
I know her husband told her. She was like, I'm here because my husband told me I have dog breath. And I was like,
oh my.
and she did periodontal disease. And like, I was,
Oh my
I was like,
gosh.
stop it. Dogs are adorable. He just loves you so much.
Oh my gosh. That would have got me kicked out of the house.
And I've had plenty of husbands. My wife's making me do this. Haven't been in for 20 years, but my wife's making me do this, and like I can smell the breath. I'm like, I bet she is making you do
Mm,
this. I bet she is.
it's bad. I
Yeah.
mean, you come across and let's be honest, some people's breath, it's foul.
Yeah.
I don't want to just, I can call it out and say, yeah, it just pure stinks. I'm gonna do it obviously
Yeah.
in the nicest way possible.
Yeah. Yeah.
Um,
Yeah. Yeah.
and just kind of wonder like, yeah, I don't know
Yeah. It's
how much
right.
they
How do you? It's like
invest.
asking someone if they're pregnant. Like, ooh,
Yeah,
how do I do that?
it's
Let's just wait.
but
Um,
I've often always wondered about that, wondering like, okay, where does the stench come from? Is that
yeah.
lack of
Hmm.
flossing, brushing,
It's a
mouthwash? Um,
it's a disbalance of some sort, Aaron. It really is. And the
mhm,
bacteria technically that causes that halitosis, that bad breath, actually resides on the tongue, the top of the tongue towards that. You have bigger taste buds hanging out. They kind of look like the top of a mushroom shape. Um, so getting a tongue scraper is going to benefit that. Doing that definitely in the morning.
mhm.
If you can do it at night too, great. But uh, mouth rinse if you're using like something that's got alcohol in it, something that again is killing all the bacteria. If you can do something that's an alkaline based mouth rinse, that's going to be best to help give the good bacteria in the mouth the right environment to thrive. So that way they outnumber the bad guys that's causing the bad breath, right? Um, but it can also, if it really doesn't go away after that, then we start thinking like, oh, do we have something systemic going on? You
Mhm.
know, and then we can really dive into that. But usually it's just here's a tongue scraper. Stop using this kind of mouth rinse. Let's get your teeth cleaned. And usually they're pretty happy. Uh, After that, the next visit, they notice
Mhm.
the difference because you I feel like as a person can kind of tell too.
Yeah.
And if you feel like you do, something you can always do to check is lick your wrist and then smell your wrist. And then if you're like you'll be able to tell like, oh, is it stinky? Is it not stinky? And
Mhm.
yeah, yeah, yeah,
Okay.
yeah.
Because I'm often wondering, we see the kind of commercials that state, um, hey, this mouthwash kills 99.9% of the germs.
Mm,
And half the time I'm wondering, okay, is that fact? Is that fiction? Who did the research
yes.
in that?
Oh, yeah. If they probably are killing 99.9% of germs, and that's so scary. Don't do
So,
that.
yeah.
Yeah, don't do that.
But I've also noticed that some particular very popular brands that we see, whether it's a store brand or a very high end name brand, the
hmm
content and I think this goes back to what you mentioned about checking the ingredients. Is some of them
hmm
just straight taste like it's alcohol. Like
Yeah,
you
yeah,
you
yeah,
take
yeah.
you take a sip, it burns your mouth. You quickly just want to get it out of your
Yes.
mouth. So
And yeah, yeah, yeah. Great observation with the burning too. And like, Aaron, what would you do if you used lotion and it burned your skin?
right, you'd get rid of it.
Right? You'd stop using it,
Hmm.
right? So that's what I tell my patients. I'm like, what if you use shampoo that like burned your scalp? Would you keep using it or like would you get rid of it? So that same thought process of
Hmm.
would I put this on the rest of my body? That's what I say about people not brushing for 2 minutes. I'm like, we're not actually. That's what I say with flossing. I tell people in between our teeth is 1/3 of our overall tooth structure. So when you don't floss, that's 1/3 of your total surface area not getting clean. And I compare that to taking a shower. When we take a shower, we will usually wash our whole body, right? We don't
Hmm.
skip a third, unless maybe you're one of my teenage brothers. I'm sure they skip a third, but
Oh my God.
uh, yeah, but we try not to, okay?
Yeah.
And you know what? I'll also tell them too, like that if that little itty bitty piece of plastic string floss is making your gums bleed heavily, like, that's concerning because if you took that little piece of string
Hmm.
floss and like put it between your fingers
Hmm.
or flicked your thigh with it and it started to heavily bleed, you'd be like, why is that happening?
Hmm.
Is that normal? Should I be concerned? So like it's so funny just because um it's all behind closed lips. We're like, oh, it's fine. It's normal. I I bleed when I clean when I shower too. It's no big deal. Like I
Oh
think
man.
if you were washing your body and you started bleeding, you'd be like on high alert, right?
Yeah.
So I
Big
like
time.
for my patients to have that same mindset, and if they still give it their all, their home care is rocking, and they are still having some bleeding gums, then we know that we got to dig deeper, right? Because the mouth is so much more than just brushing and flossing, right? Bleeding gums can be a vitamin deficiency. Are you lacking A, D, K,
Mhm.
any of those vitamins? Because if you're in Washington, you're definitely lacking vitamin D. Okay, so
Well, I
if you're
think
not
all of
getting
us
it,
are. We don't get the sun very often.
no, no, not enough. Especially today was pretty nice. It was a good spring day. Um, we needed the rain, to be honest, we did. But bleeding gums. Aaron, bleeding gums can literally be a sign of things like our diabetes isn't doing well. It could
Hmm.
be a sign of pregnancy. It could be a sign of colon cancer. It can be a sign of leukemia, right? It can be a sign of so many different things. So
Hmm.
so when when we do still have bleeding gums and we've done all the things we're supposed to do to get it under control and we still don't, that's when we say, okay, let's keep diving deep. And hygienists have saved lives and caught in things early because of their diligence and their attention to detail and their passion and how much they care for their patients, right? Because you build such a good rapport. People see their dentist for 20, 30 years, right?
Mm-hmm.
That's a long time to know somebody.
It is.
Um, yeah, so it's really it's really important. It's important for not just our patients to know, but for our dental community to know too, right? Because not everybody knows the same thing. There's plenty of people out there that are dental professionals uh, who weren't taught about a balanced microbiome. You know, I was. And they get taught those kind of old school methods, but you know, we'll eventually get there. And I'm sure things will change again once we're all there, and then we'll continue to get there.
Mm-hmm. We will. You know, I have to ask, in a lot of people that whether they're kind of up and coming or maybe they are just kind of getting started, and they're probably taking on the same workload that you once had, and they're probably
Yeah.
asking themselves like, how in the world do you do this? Like, can I
Mm-hmm.
actually do this? So
Yes.
imagine if, you know, let's say your 21-year-old self, you were coaching back your 21-year-old self, or that 19-year-old version of you. What
Mm-hmm.
piece of advice would you give that person today that's
Yeah.
just starting out? Hey, I'm trying. You know, I have a goal. I
Yeah.
want to be a hygienist. I want to be a
Mm-hmm.
dentist. I want to
Mm-hmm.
eventually build my own practice. What's the advice you would give
Yeah.
them today?
So I will say first and foremost, my prereqs were yes between 19 to 21. I did not get into hygiene school until I was 27, and there were also people who were turning 50 in that program. So just remember age. Don't ever feel too old to go back and get an education. And I would tell you that every sacrifice is worth it, and to stay focused and to stay determined. We're doing it for the bigger picture. Remember,
Mm-hmm.
a little bit of suck for a lot of bit of great, right? This
Mm-hmm.
this moment is hard and this moment sucks, but it's just this moment. I was very tired when I was in school, and I would have to tell myself it's just tired. I'm just tired.
Mm-hmm.
There's so many worse things you can be than tired, right? And you have to stay focused and just give it your all. Be friends with the girls in your class. You guys have to have each other's back. Just once you're in the program, just focus on being the best hygienist you can be. You don't need to have straight A's anymore. You're in the program, right? Now,
Mm-hmm.
you just got to be the best hygienist you can be, and don't stop. Just keep going. Like I said, even if you're not taking those big full strides and you're just doing some shuffling, that's okay.
Mm-hmm.
Believe in yourself, because if you don't believe in yourself, who else is going to believe in you? Have, make sure you surround yourself with people that believe in you. Uh,
Mm-hmm.
have those boundaries to cut out the people who don't. That's
Yeah,
hard
it
because
is.
sometimes those people are close.
Mm-hmm.
But you have to. This is your life. You have all the choices. I didn't come from some big fancy home. I'm first college graduate. I've always said, if God, if I've never been like this, someone special. If I can do it, like you can do it too. Um, and just keep grinding, don't stop, and just continue to do things you love, no matter what it is, even outside of dentistry. That's important too,
Mm-hmm.
right? Like we talked about that life balance. Especially now as a hygienist, so it's a lot easier. But like in school and stuff, yeah, just don't just don't stop believing.
That's yeah, that's spot on right there.
Seriously, it
Just
sounds
don't
so
stop.
corny, but it's so true. Like,
Mm-hmm.
if you don't believe in yourself, who else is going to?
Mm-hmm.
And then making sure, like, when you're having a hard time believing in yourself, that you have people that will help you, will believe in you
Mm-hmm.
so much you'll start believing
Yeah,
in yourself again, you know?
yeah,
Help get you back on track.
yeah. Now your next steps that you're on right now, and it looks like you're kind of venturing into building, basically you've kind of started branding into your own like business venture. So
Hmm.
talk a little bit about that. What's that avenue like right now? Where do you see that going here, whether it's in, you know, in the next like year or so? How do you see that continuing to grow?
Oh, my new business. How fun. I've always wanted to be a business owner. So I am now a myofunctional therapist. Uh, the short description of that is like the physical therapist of the mouth, right? Making sure we're having proper function of our lips, of our cheeks, of our tongue, all that good stuff. Making sure we're breathing good, breathing right, sleeping good, all that good stuff. Um, and I tell myself every day how successful it's going to be. I manifest it. We're going
Mhm.
big or going home. We're having a successful business. And I did actually have my third consult today.
Wow.
And it's my first patient to schedule for a comprehensive evaluation. So that's like the very first step to doing the myofunctional therapist program. And I'm very excited. I'm very nervous, right? And I take that energy
Mhm.
and I put it towards making sure I'm going to do my best to be the best myofunctional therapist for this gal. And yeah, I want to see it be big. I want to see it be big where I need employees. I want to see it be big where I'm teaching people how to do it,
Mhm.
right? Because I wanted to be an educator. I've always thought like doing lectures and doing public speaking is something that interests me as well. Um, and I'm very excited because I know
Yeah.
what a big difference it made for me uh, to stop grinding and cinching and to stop feeling so exhausted when I wake up in the morning because I'm not breathing right in my sleep, so can't get into REM. Can't get into REM sleep if you're mouth breathing,
Mhm.
right? Well, why are we mouth breathing? Well, where's our tongue? Why is our tongue not where it should be? How do we get it there? And just play detective. And I'm excited. I'm excited to help people breathe better again, so they can sleep better, so they can live better. Because that's what it's all about, right?
Right. That is. And you being a first generation college graduate, how proud would you say your parents are right now as they see you? They see, hey, they raised a successful, a
Mm-hmm.
wonderful daughter, a successful young woman, and now a successful businesswoman now that's blooming. How proud would you say they are today?
Oh, I'm sure they're very proud. Um, you know, it's it's a tricky conversation because I don't have the best relationship with my parents. Um, and that sometimes happens. And that was one of those hard decisions I had to make while in school.
Mm,
People who weren't um, helping me in the ways I needed them to help and support me in the ways I needed. Uh, so I'm sure they're proud, but we have a
yeah.
complicated relationship. I feel like most people do. I'm one of those most.
All good. But the biggest thing is that you're inspiring lots and lots,
Yeah.
especially women out there.
Mm,
I think
yes.
that's the biggest thing that you're doing. And I think how you've continued to grow, how you've continued to educate yourself. I think this is only the best to come. So I'm
Yes.
excited to kind of see where your journey takes
Thank
and where,
you.
and I'm so thankful that I was able to have you on here to be able to share some of that wisdom, to be able
Yes.
to share some of the, just the pros, the goods. And this is
Yeah.
why having a great hygienist in your corner definitely
Oh yeah.
benefits you. So,
Oh yeah. Absolutely. I can't
yeah.
tell you how much it does make a difference because I've had both. I've had great and I've had not so great. And let me tell you how good it feels,
Yeah.
literally, when you have a great hygienist.
Hmm.
Well, thank you for having me on
Yeah.
here. On here, it's been such a pleasure to see you and
Absolutely.
to see you doing this too, and
Yeah.
shining the light on those who, yeah, thought to be where they are. And I definitely am here to motivate, inspire. I love being people's hype man. I'm here to
Mhm.
support you. I'm here to lift you up. That's my patients. They know that I let them know having me in your corner, I'm not going to let you fail,
Yeah.
right? I'm going to help you get back up over and over again because sometimes you need people to care about you more than you can care about yourself at those times. And if I can be
Absolutely.
that person for people at times, I don't mind. I'll do it.
Hmm.
I've got lots of love to give. So
Yeah,
yeah.
absolutely. Absolutely.